My name is Mert Aksu. I'm the Dean of the School of Dentistry at the University of Detroit Mercy. I graduated in 1987 with a D.D.S. from the University of Michigan and have a J.D. from Wayne State University and a Master's in Health Services Administration from the University of Michigan School of Public Health.
My name is Blaine Jacobson. I actually first graduated UC Davis with an engineering degree, and I graduated Harvard Dental School in 2006, and then I went on to a residency in orthodontics and graduated in 2008.
I'm Gary Jeffers. In addition to being the Interim Director of Admissions at the University of Detroit Mercy School of Dentistry, I'm also a faculty member in their Department of Oral and Maxillofacial Surgery. I went to dental school at the University of Pittsburgh and received my D.M.D. degree there, followed by 4 years in the Navy, where I did a general practice residency. And then I did my oral and maxillofacial surgery residency at Emory University in Atlanta, Georgia. And I have a master's degree in physiology and pharmacology from Ohio University, which I did before I went to dental school.
Hi, I'm Alan Wong. I'm a graduate from Arthur A. Dugoni School of Dentistry, University of Pacific. I graduated there with my D.D.S, my educational doctorate from University of Pacific School of Education, and I'm currently a professor there. Advanced trained 2 years as a general dentist, and I run a hospital dentistry program as well as a postdoctoral general dentistry program.
Good morning, I'm Craig Yarborough. I'm the Associate Dean for Institutional Advancement at the University of Pacific, Arthur A. Dugoni School of Dentistry. That job mainly means that I turn dreams into reality. I was Dean of Admissions for 10 years, as well as Dean of Development for 10 years also. And it's good to be here. Born and raised in Lodi, 1980 graduate of the Pacific Dugoni School of Dentistry, also Pacific undergrad, and then an M.B.A. from Pacific. So I was pretty proud of that until somebody said it would be the only school that would accept you. And that's probably true too. So good to be here.
I'm Navneet Sahota. I'm a graduate of Arthur A. Dugoni School of Dentistry 2011, and I'm currently doing private practice, so if you guys have any questions regarding that, I'd be happy to answer.
Our first question is, what aspect of your specialty did you find most attractive? We start with Dr. Aksu.
I'm a general dentist, and graduating in 1987, my first responsibility was to working in the dental school was to treat the patients that were too complex or had problems with the dental school treatment. As a general dentist, I find one of the most satisfying aspects is that I have a relationship with patients that requires primary care and continued primary care. The relationship that I established with many of the patients I've treated over the past 25 years went well beyond just taking care of their oral health. They become part of your family. They tell you stories about their kids, their parents, their life. Many times, general dentist has a better relationship with their patients than primary care physicians even do. And so, as a general dentist, I enjoyed that. I also enjoyed making a difference in their lives with the care that I provided and the advice that I gave them regarding their oral health.
Practicing orthodontics with the engineering background, I was very excited about all the biomechanics that goes into what it is that an orthodontist does. I also really like the fact that patients are so excited to go into orthodontic treatment, usually excited most of the treatment, and very excited when it's done. So I like the fact that at most of the time through the procedure, it's a very good relationship with the patient, and the fear level that the patients have is much less than some of the other specialties. So those were some of the things that brought me to orthodontics.
Oral and maxillofacial surgery is the specialty that sort of bridges the gap between dentistry and medicine. It covers both of these fields very well, and it enables an individual in that specialty to do a variety of different types of treatment. And the area of oral surgery that I enjoy the most is anesthesiology. I also have a certificate in anesthesiology, so I spend most of my time involved in that area. And the next area of oral surgery that I found to be very rewarding was the treatment of trauma. One thing about that is it's an area where you have to really think on your feet and improvise in order to provide treatment. Many times you're faced with a lot of different calamities that come on you and things that you've never seen before and you'll never see again. So no two cases are alike. It just is a very rewarding area of dentistry.
I'm a general dentist and not a specialist, but did a lot of advanced training for postdoctoral. And I couldn't decide on one particular aspect of dentistry that I just wanted to devote my life to. I liked it all. I liked restoring teeth. I liked the moving of teeth. I liked extracting teeth. I liked creating smiles. And I liked treating patients with developmental disabilities and those that couldn't afford care and give care. So I was a private practice dentist, am a private practice dentist, and able to see kids to adults to patients at the hospital. So I couldn't decide. I liked all aspects of dentistry, and the dentist that I was when I graduated is not the dentist that I am now. Technology has really come a long, long way, and I'm glad I didn't sort of cover myself into one little specialty, but it's an amazing career and a lot of choices, so you don't have to narrow yourself down to any specialty at this point, but if something embraces you and calls to you really, then go for it. But I couldn't decide on a subspecialty, so I like it all, do it all, and enjoy it all.
I practiced for 13 years in Lodi, and I think the simple truth is probably people. There's nothing better than probably sitting down and earning the responsibility of their trust and confidence, and that's a big plus. To have a patient say thank you for a procedure is just over the top. Probably the second aspect is leadership. And when you build a team within an office and things run smoothly, the day goes really well and lives are changed during that day, whether it's the patients or your team. So patience and leadership.
I'm kind of going to agree with Dr. Wong. I like bits of everything. I didn't want to limit myself, and I like the fact that I can treat kids to adults. I don't have to limit myself to a procedure. I enjoy extractions, root canals, and general dentistry kind of gives me, an aspect to do a bit of everything that I like. And I've also started incorporating a bit of ortho, mainly doing Invisalign. So I like that fact that you're not limited to anything. You can always do advanced courses and, kind of see what you like to do more of. So I really enjoy that fact.
Okay, thank you. Our next question is also open to everyone. What advancements are occurring in your field, and where do you see the field in 10 years? You can start with Dr. Aksu.
The area of interest that I have and the area of interest that I spend most of my academic time on is the policy, public policy in dentistry. I see an evolving world with regards to the profession related to public policy. 100 million people today do not have access to regular dental care. 100 million people who vote, who have public influence, who are going to impact the profession. We oftentimes point our fingers to the CAD/CAM technology or the advancement in material sciences or the advancement in genomics or the possibility of growing teeth or preventing bacteria from causing decay. But until those things actually come to fruition and make a difference for the rank and file person who's out there, you still have 100 million people who aren't getting regular dental care. I see dentistry evolving in many ways, particularly with the Affordable Care Act and the accountability of oral health being part of the overall health of the patient. Again, another public policy issue. And the reason I say that is that the allocation of money, the allocation of funding for public health or dental health is related to public policy and what's going to improve the overall health of our population. We can certainly point our fingers to a number of the technology advancements and the number of advancements related to all the things I just stated, CAD/CAMs, implants, et cetera. But still, when you have such a large population in such a rich country not having access to dental care, it will impact the profession for sure.
I guess from my perspective as an orthodontist, some of the developments that are really guiding the light to the future of my profession are three-dimensional diagnostics, where we can see things that we weren't able to see 20 years ago, which enables us to diagnose more accurately, plan more efficiently, and be able to, provide treatments that can get to the root of the problem faster, providing better results. And that's where I see most of the benefit. There are some benefits in material science that have aided a lot to the profession over the last 20 years as well. And so I think that those are a lot of the advancements that we've seen and are really doing some great things for the orthodontics.
In oral and maxillofacial surgery, there are so many different things that are coming up all the time. The main thing is to keep up on the literature, which thoroughly investigates all of these new changes and advancements that come through our profession. I am not one who looks ahead so much toward advancements, but to deal with the things that we have available to us now, because that's reality, that's real-time management, and that is what you have to deal with. So I don't think that the advancements that we have looming ahead for us in my particular specialty are the thing that makes the specialty important to me. It's dealing with what we have available now.
Dentistry has come a long way. It's often been thought of more of a trade, but it really is an integral part of medicine itself. And what I teach at the dental school is karyology, and the oral systemic connection and its association. Dentists are not just people that fix teeth and take care of gums, but really lower systemic conditions in the person. I work with a lot of hospitals in terms of transplant teams and cardiovascular teams, and they're constantly looking at the dentist to help lower those bacteremia chances in those cases and improve health in general. So dentistry right now, a couple things fascinate me. The more studies that they were having with associated risk in terms of health, and as educators as well as practitioners to make your patients healthier, orally as well as systemically. On the technology side, it's just amazing technology where we can prepare a tooth in the same setting, have a crown fabricated by a computerized machine to mill out something right at that time. That's fascinating. That's something that I never imagined when I was a dental student. And the ability to create smiles with implants now, that is no longer a fascination. It's a reality, and it's becoming more affordable. So there's a lot of things about dentistry that technologically is really impressive, but more impressive is our science. We're looking at how to prevent dental caries from occurring, because as stated before, dental caries is one of the most untreated diseases in America that's almost epidemic, that's on a rise still. And we have all the technology to educate a lot of people that we can help reduce that. So a lot of changes.
When I graduated a little over 400 years ago, it seemed like the easiest part was really the clinical dentistry. The harder part was probably the business side of that. Where I see dentistry going in the future is, I heard a presentation at the ADA last year, and what they talked about was corporate dentistry. And right now, 17% of dentists work in a corporate dentistry setting. In 5 years, it'll be 25%. What that tells me is that you're going to have to learn the business side and the economies of scale and some of the things that my M.B.A. has kind of taught me. The short version would probably be, when I graduated from dental school, when I would graduate from dental school today, I'd be looking at a couple of partners. I think at least 2 others. And I'd be looking at an office situation where you can philosophically have 3 people who can open that office from 6 o'clock in the morning till 8 at night, 2 different shifts. And I'd do that probably 7 days a week, so that you offer your patient pool a total care prospect there. Because I think without that, it's going to be difficult to compete against corporate dentistry.
I think they've pretty much covered everything, but there's always new things coming up. Like when I graduated, I think that's pretty recent, 2011. Now I feel they're teaching digital impression techniques, so there's always something new coming up, different ways to diagnose caries. Basically, I don't think there's going to be one set standard. We're always going to be learning new things as we go.
This next question is for Dr. Sahota. How can I make the most out of my shadowing experiences?
With the shadowing, I think it definitely helps, especially if you're at a stage where, you don't know exactly if that's the thing. For me, I have a lot of actually students that did that, shadowed me, because they weren't really unsure if dentistry is the career for them. A lot of female students also weren't sure if this is the career for them. I think if, to know, reading and anything, shadowing, you can kind of put yourself in a day, see how they work, what hours they're working. You can kind of observe what procedures are there and then kind of decide if this is the route you want to go. Also from a female point of view, to balance the life of working, like I'm a full-time mom right now, and also I'm doing part-time, so I like the fact that I can balance that with my career. So that's another thing, and then shadowing will definitely help you decide, to make the right decision.
And if anyone else would like to add to that.
I will add to that. I think it's important that when you go out and do your shadowing that you really start by focusing your shadowing on general dentistry, because that is what you're all going to have to be before you can consider going into a specialty. If you have a large variety of shadowing experiences with a general dentist, then after that it might be advisable to start looking at some of the specialties to see what they have to offer. I mentioned in the earlier panel when I spoke, when I went to dental school, I had no idea I was going to end up being an oral and maxillofacial surgeon. When I finished dental school, I was sure I was going to be a pediatric dentist, the farthest thing from oral surgery. And it wasn't until the experiences that I had in my GPR in my first year in the Navy, when I had all the big oral surgery cases coming my way at night when I had to take call, that my focus changed entirely. And I was with 4 other guys. We were called the Gang of 5 at the time, I guess, and we all went into that GPR with the preconceived idea of specializing in one thing or another, and every one of the 5 of us changed our focus based on our experiences during that 1 year. So stay open-minded about all of this and see where your life's path are going to take you.
I have something to add. I actually have some of my shadowing students are even here in the room today, because I practice local in Davis, so I have a lot of people who come from Davis to go do that. So for the last 5 years, I have people who come in, and the first thing I tell them to do is, you're here to watch. Some come in with thinking, oh, I'll clean this for you, and I'll do this, and that's fine, and you appreciate the you appreciate what they're asking to do, but you invite them in because they have an interest in the same career that you have on it, and you want them to watch, you want them to be able to ask questions, and actually get a feel for what it is they want to do. They're not free labor. So this is something I feel is really important when somebody wants to shadow, is that they need to come in, ask the questions, get what they can out of it. And as a specialist, I feel the same way. I say that this might be an element of what you're interested in looking at, but look at the whole picture. And applying to a dental school, simply saying I shadowed or interned with an orthodontist for a year, they say, oh, well, do you have any interest in dentistry? Because that's something to talk about in the future. So I do think it's valuable, but I think it's important that when you shadow anywhere, you take advantage of the opportunity there to ask questions and you focus on watching what's happening.
Okay, thank you. To
Can I
those
answer
of
one?
Yeah, go.
Yeah, I think it's really important to shadow, and I think the variability, I agree with the previous speaker that at least 5 general practice offices for a half a day would be great, and about 5 specialty offices. And I'd ask a similar set of questions, and I'd make sure I'd come across a couple of dentists who said, I would not go into this profession, okay? Because I think you'll learn the most from them. It's easy to get positive reinforcement for the profession, but a lot of the individuals that you're going to learn from, you can learn from who don't really want to get in there. And they're going to say, if it wasn't for the patients, this would be great, just working on the teeth. And what they're saying is they haven't quite learned to build a comfortable relationship with their patients. And then second thing would be, I wouldn't go into the profession again because of the team. It's hard to provide leadership for the people in this particular office. Then you should learn those skills while you're there now. Or I wouldn't go into dentistry because of insurance companies and third-party carriers. That's another way of saying I don't have a strong foundation in business in which I would get that. So learn from those people who say don't go into this profession because they were probably right for them, but make sure it's right for you.
Okay, Thank you. To those of you that have completed one, what are the benefits of doing a residency in general dentistry?
Well, I did one, and I found it to be extremely helpful. That is where you learn to be a super specialist and handle everything that will come your way in general dentistry, except for the most difficult of all specialty situations, and then you have to know when to refer. You need to know what your limits are, your limits of your capabilities in that. So you should be able to get a whole lot of very good experience and very good usable experience from a GPR or an AEGD. And as I said, that was when I learned that there was an area of dentistry that was of particular interest to me. And it was different from what my opinion was before that.
Okay, thank you. Oh, you go
I'm
ahead.
going to answer it as an educator, having not done one, but been with two different dental schools that both have had residency programs for the past 25 years. Dental school has a lot of information coming at you. When you graduate as a dentist, you're basically an early competent practitioner. Your ability to practice your profession is only strengthened by a residency. The residency program allows you to pull it all together, take it to a different level, move yourself up the curve faster than anybody else graduating from dental school. A residency program also allows you to capture the essence of a variety of different specialties in a way that you can't in dental school, with more one-on-one mentoring and coaching and more complex cases. You can develop your own interests, develop yourself as a practitioner, and come out of the residency program in a way that you can manage the care of your patients at a much higher level than you could just graduating from dental school.
Couldn't have said it better. Running a residency program, I think it's integral to be able to learn autonomy, and that extra year of learning allows you to do that. Most all dental schools provide you a very safe beginner-level learning. A residency program allows you to further that, working with specialists and working on a little more complicated situations, to develop your own practice, your own abilities to handle situations, not only in dentistry, but in the business aspect itself. In state of California, if you're practicing in state of California, it's such valued that if you do a year residency anywhere, an accredited residency, you're able to attain your license without having to do what's called a state board, which is another grueling process, but we can talk more about that later. But it's very valuable and highly sought after afterwards.
This next question is for Dr. Yarborough. What are the benefits of getting an M.B.A. with the dentistry degree?
Yeah, it's a really good question, Rami. Thank you. I'm not sure there's great value to it for the normal practitioner. And I talked a little bit earlier about if you're going to put together two other people and you're going to form a limited corporation or whatever, I think there's advantages to that. If I'm going to run my single practice, maybe by myself, I don't think there's much advantage. I think there's components within an MBA that would be really important, though. And some of the components would be a small business accounting type of course. Another one would be small business marketing. Another one would be leadership and management of people. So there's components within an MBA, but I don't think a two-year program is really give you a good return on investment. So I would look at the components of it. If you're going to go into administration like myself, I think it's invaluable, though.
Thank you. And for Dr. Aksu, how can one benefit from getting a law degree with the dentistry degree?
I would say the same as what Dr. Yarborough said. Basically, for 85% of the graduates today, the essence of success is going to be in your clinical training and your ability to provide care effectively and efficiently. For those of you who are interested in participating in policy or in management or in consulting with insurance companies, these ancillary degrees provide opportunities to have doors opened. For me, I graduated from dental school when I was 23. I looked at the law degree as providing me dynamics over a long career. You know, practicing dentistry for 40 years can be fairly challenging, but the opportunity for me to get additional education gave me the opportunity to have a dynamic career where I wasn't going to be relying solely on clinical practice for 40 years.
This is open to all. How are new government healthcare policies applying to dentistry? Yeah.
I think that with regards to the Affordable Care Act, dentistry is pretty much officially out of the Affordable Care Act with the exception of children. Children are uniformly covered under the Affordable Care Act with regards to dentistry. The uniform coverage has certainly expanded the population of federally funded children. That expansion will likely overwhelm the profession if it was consumed by 100% of those who are eligible to have the benefit. There aren't enough providers to meet the need right now. With regards to the remaining population of adults who aren't covered, who lack insurance, I think the Affordable Care Act is going to drive physicians to expect that their adult patients get dental care. And the reason that is because physician compensations will be based on healthcare outcomes. And you'll hear a little bit about this in my own sort of Future of Dentistry program, but with the ACO, Accountable Care Organizations, and the Affordable Care Act method for reimbursement, physicians get paid more with less complications, with shorter hospital stays, and there's evidence that a clean mouth can help contribute to both of those. So if physicians are going to get paid more on outcomes that are related to proper oral health, they're going to be driving their patients to physicians. I mean, your oncology patients, your organ transplant patients, your pregnant patients, your diabetic patients, all of those patients can benefit from having a regular oral health care plan.
Well, I actually take government insurance in my own practice. For orthodontics, it's a special subset of individuals who qualify for that. But I actively promote that, private practice doctors should be taking, here in California, Medicaid, or Medi-Cal. And the number of patients who are fitting into that window is increasing dramatically with the Affordable Care Act. And in this state, as of April of next year, adults are going to have their coverage extended as well. It won't be quite what children's coverage is. And I believe that all private practice doctors should incorporate some elements of those government insurances into their practice, because anytime there's a coverage available that the vast majority of the doctors won't provide, it opens up an opportunity for something else to fill that. And I feel like we're quite able to take care of it if everybody does participate and take care of the plan. So I think the increased number of people in Medicaid is going to require some more involvement from the private practice community. And the more involvement they have, the better we can shape those plans for the future to take care of everybody's needs better.
I'd agree with Dr. Aksu. I think the Affordable Health Care Act is going to have an interesting effect long term. If you go back in medicine 20 to 30 years ago, and they started having more third parties involved in that, you saw individual physicians joining hospitals. And so there's more of a corporate medicine type of model. $6 billion industry is medicine currently, and I think the Affordable Health Care is trying to get that under control admirably. But I think down the stream what's going to happen is that the next domino will be dentistry, and so we have to be able to adapt that particular model, learn from the experience of physicians going into this particular model, and then adapt to it as dentists as it comes on. Right now, dentistry is just not a big enough industry for the government to care, but as soon as they get the Affordable Care Act implemented and hopefully functioning positively, which is a big question mark, dentistry will be next. So learn from that.
Okay, thank you. This next question is also open to everyone. What are your recommendations to students that want to go to private practice soon after dental school?
I finished my residency and I went into private practice immediately, but I did it in similar to what Dr. Yarborough has said. I had two of my classmates and we opened an office together and we shared our overhead expenses. So we each worked about 2.5 to 3 days alternating schedules. And by sharing the overhead, we were able to keep our costs down and our enjoyment of dentistry up. Currently, most people go bankrupt because to open an office costs a lot of money and the overhead is just overwhelming. But when you share that overhead, you're able to survive a lot easier. I wouldn't have had that confidence had I not done a residency program. And most people, I think, would go out and associate as first, but that's my personal experience and never regretted it.
Yeah, I agree with that. As a new grad, I initially wanted to, because you want to be more confident with everything and just kind of like jumping, let's see what happens. So I think it's a good idea if you don't have an advanced degree to go into work for a big corporation, get your experience, get your confidence build up, and then go from there, like associate for a while after that. But I think jumping right in, unless you are that type of person that wants to, just do all the risks and leave the rest to God. So I think it's a good idea to do that.
I would say plan ahead. It's not a small task to go in and start a business. You play so many roles in that business that you own that you need to plan ahead, and you need to find good partners to work with you. Now, in the situation, I'm not talking about partners necessarily that are dentists, but partners that are, a lawyer, an accountant, people that can help you do that, because your education might not have been focused on that, even if there's in parts included. So partner intelligently to make sure that what you're doing in the future works out, gives you at least the best chance of working out. Listen to people who have experience, because there are some times that people will come over and they'll say, we don't need another specialist like this in our area, and they might just not want you there. Or they might be actually being friendly and lending out a helping hand, seeing what part of the future. So, and I also think that you have to be careful, because a lot of the people that approach you are vendors that are trying to sell you on something, for you to buy onto. So you have to partner with people, but you also have to have a healthy level of suspicion of, what is this other party's part in it. I think sometimes getting involved with the local dental societies is really going to help you focus. Getting a little bit involved in your organized dentistry is really going to help you focus those people who you can trust, who are willing to help you out, and will help also get you in touch with those other individuals that can help you out and give you a better chance of success.
As in my position, believe it or not, I owned a private practice for almost 10 years, and one of the things I would tell a young graduate when entering into private practice is it's not about gross revenue, it's about net revenue. It's about predictable clinical outcomes, and it's about developing a system where you're operating within your personal philosophy of practice, that you're doing the types of things that are comfortable with your own moral compass, that you're not doing things that someone else is telling you to do because you need to make money.
Yeah, I think when you graduate, that's not the time to look for a job. Looking for a job is a year in advance. I know my daughter graduated in 2009. My son is graduating in 9 months from dental school. And 3 months ago is when I told him to start looking, where do you want to go? Start networking. So I would look at the demographics of where I want to live. And the ratio right now of population to dentist should be about 1,700 to 1. You can call up the Chamber of Commerce and find that information. What's the population? What's the number of dentists? Do your division. You've all taken QR on the DAT, so you should have that math skill. That was my best joke. So look about a year in advance. You can start with your dental school. They have an alumni network, and they should have dentists in different communities. Sit down with them. So a year in advance, what you're not looking for is a job. You're looking for information. Would you come here again? All of that. They're going to tell you a lot of different things. The economy's slow, all of those. But what you're looking for really is just sitting across from this person, and you're doing an informal interview. And if you do enough of them in that particular area, they start thinking a year in advance, they may want to hire you as an associate. So really getting a job is a year in advance, not at graduation when you walk across the stage.
We have time for one last question. Do you have any advice for our guest today?
All right, I do. Make sure this is really what you want and love it with a passion. Find mentors that connect with you. So when you're doing your visitations, your shadowing, find someone that you think that, wow, that's something I can really do, and maybe I can use them as a mentor, because it is a very long journey, albeit a very fun one if you like it. I've really enjoyed mine. I've come sort of full circle because after starting private practice for 22 years, I've come back to teaching, and it thrills me to no end that dentistry is so fun, and I really like it. So do it with a passion. Don't do it for other people's want or because of the money aspect. But if you don't really like working with people, don't like working with your hands, this is not what's for you. But it's a great healthcare opportunity, so do it with a passion.
I'll say that I would recommend enjoying the process all the way along, as much as stressful as it is. You know, if you don't specialize, this time applying to dental school, the first time you'll find 10 schools or 12 schools. You'll be thinking, which state am I going to live in? Which area am I going to live into? What do I like about these different schools? When you're in dental school, it'll be a completely different experience than anything you ever had. And work hard, but enjoy the process. You'll never get quite the same, society to work around you with, unless, of course, you stick into academic dentistry, which would be great. But enjoy the process the entire time along, and don't just plan off with the goal at the end of the road and keep on charging for it. Enjoy what you go through, because it's a wonderful experience that you won't be able to live through a second time. So.
Yeah, I'd probably follow up on Alan. I think find your passion, and then you don't have to work. The next thing is early birds catch worms. Don't look at the deadline for applications. Look at the opening gate. I would be applying in the first week of June. And somewhat regardless of when I took the DAT, meaning it's nice to have the DAT in hand before you apply, but I think you got up to about July, because what happens is there's a 4 to 6 week lag time when they accept your application, and most schools start looking at applications in about July, if not August. And if you're not in the applicant pool, it's really hard to get an interview. So early, you get rewarded for early applications. Case in point, in July to August, we probably have 1,500 applications on our way to 3,100. So it's much easier to probably get accepted or get an interview when you're competing against 1,500, not 3,000. Every week that goes by, you're fighting for fewer and fewer seats in the class.
I'd make one last comment. I think your choice of dental school has to be based upon what your criteria are. So have a clear understanding of what criteria are important to you, whether it's location, cost, type of program, numbers of graduate programs. Some people like to go to dental schools with large numbers of graduate programs. Some people pick dental schools that have fewer graduate programs. There are benefits each way, depending upon how you look at it. Understand also that the choice to go into dentistry and the choice to go to a dental school is more than just pursuing education. It's going to change the way you look at life. You're going to become a doctor. When you graduate, you're not just getting a job, but you're getting a position in society with expectations that last beyond the 8 to 5 time period. They're 24 hours a day.
Okay, thank you very much. And that was the end of our Careers in Dentistry panel.